Although voluntary non-remunerated blood donation has been promoted in Taiwan for more than 40 years, most donors received payment prior to 1974. It wasn't until President Pei Huo-tsai of the Red Cross Taiwan Provincial Society founded the Chinese Blood Donation Association on April 19, 1974, that blood donation was gradually made voluntary. The Medical Care Act stipulates that a blood donation organization should be considered a medical care institute. The association helped set up the current Taiwan Blood Services Foundation on January 1, 1990, to advance the movement. The Taiwan Blood Services Foundation is responsible for donation and delivery. The Board of Directors is the highest authority in the organization. The Medical Advisory Committee addresses medical-related issues. There are 7 function departments, 5 blood centers, 13 blood stations, and 37 rooms providing a comfortable environment for donors. The Blood Services Foundation, an NGO and NPO, is the only blood donation organization in Taiwan. For the past 40-plus years, Taiwan's blood donation movement has prevailed due to public support. Taiwan's blood donation rate achieved 51.8 per 1,000 population in 1991, which surpassed the international threshold, making Taiwan an advanced country in blood donation. For the past decade, the donation rate has been maintained at more than 70 per 1,000 population, further moving Taiwan up in the global rankings. More than 1 million people roll up their sleeve to supply blood for 800-plus medical institutions every year. This shows that blood donation has been well accepted by the general public in Taiwan. This world-first achievement is accredited to the intensive public promotion of making a blood donation as a way to save a life, as well as the selfless contributions of donors. I am young and I give blood. Giving blood saves lives. We are warm-hearted youth. We encourage you to join our ranks and save lives. Show your love by giving blood. I love you. Thanks for your support. Taiwan's blood donation movement started more than 40 years ago. Countless celebrities and entertainers have rolled up their sleeve and joined the ranks of those saving lives, showing their support for this meaningful social movement. Do you want to become a blood donor? If you meet the following criteria, you can become one of us. You need to be between 17 and 65 years old and in good health. Female whole blood donors need to weigh more than 45 kilograms and males over 50 kilograms for blood donations of 250 milliliters and over 60 kilograms to donate 500 milliliters. The minimum acceptable hemoglobin levels for male and female donors are 13 and 12 grams per deciliter respectively. Another type of donation is apheresis, where the blood of a donor is passed through a single-use sterilized kit into a centrifuge system which separates out and collects the platelets and part of the plasma and returns other components to the donor. To guarantee blood safety, blood donors must be carefully screened. All blood centers, rooms, and vehicles of the TBSF are equipped with a private interview space where donors feel comfortable answering personal questions. All donation facilities use videos and posters to inform those at high risk for HIV infection not to donate to prevent the risk of HIV transmission. We focus on epidemic development, interviews, and donor education to prevent virus transmission through blood transfusion. We have also designed a post-donation callback leaflet to remind donors to contact us as soon as possible for appropriate follow-up action if they think they might jeopardize blood safety. Thanks to enthusiastic donors, accident victims and surgery patients are able to receive life-saving transfusions. To express our gratitude to donors, the TBSF organizes an annual event to recognize excellence in individuals and organizations, and to encourage the general public to follow suit. Meanwhile, the TBSF also provides free health checkups for regular donors, including an abdominal ultrasound. For donors over 40 years of age, we provide free cholesterol, LDL-C, and HbA1c testing every 3 years. The TBSF has set up a donor email system for speedy delivery of test reports. Test reports can be sent to donors via email. Donors can also access the donation database through our website for individual donation details. The latest information of blood donation is available via our official LINE account as well. Spread love, donate blood. The TBSF thanks every donor for your kindness. The blood collected at our donation centers has to go through centrifugation, separation of component parts, and a range of screening tests before being provided to medical institutions. To ensure blood safety, every unit of blood undergoes extensive testing with the assistance of automated precision machines. Our testing is done in the Taipei and Kaohsiung blood centers, which process up to 6,000 donations every day by using automated testing equipment. Test results are then sent to individual blood centers through the Internet to fulfill the goals of speed, accuracy, and safety. In addition to A, B, O, and RH blood group typing, a number of other tests are also performed, including RBC irregular antibody screening, ALT, syphilis TP, ABS-AG, HCV, HIV, HTLV, and NAT to ensure the highest standards of safety and blood quality. Our laboratories constantly improve our testing capabilities. Our testing accuracy has been recognized by the College of American Pathologists, the National Serology Reference Laboratory, and the American Society of Histocompatibility and Immunogenetics and the Taiwan Society of Laboratory Medicine. Our labs have also been accredited by the Taiwan Accreditation Foundation. The CDC has also recognized us as being qualified to test for acute hepatitis C, syphilis, and HIV infection. We follow strict guidelines on donor selection, standardized preparation processes, and use rigorous mechanisms. We are also ISO 9001 and PICS GMP certified to ensure the quality and safety of our blood products. Every blood center provides regular delivery services for medical institutions to serve patients in need. On September 1, 2009, we launched the first automatic low-temperature biobank, which stores samples of every donation. Traceability is made possible in the case of an emerging disease to improve transfusion safety. In compliance with the government's health policy, since January of 2007, we have collected source plasma and shipped it to CSL Bioplasma in Australia to manufacture 4 plasma derivatives, including albumin, immunoglobulin, and high-purity factors 8 and 9. The TBSF and the Taiwan Society of Blood Transfusion co-established the Taiwan Hemovigilance System in use since 2014 to improve blood transfusion safety, monitor, collect, and analyze transfusion reactions, provide feedback to participating hospitals, and serve as a reference for the national blood policy. To advance blood quality and safety, we organize on-the-job training and invite experts and scholars to improve our staff's expertise. With the theme of the pioneer of safe and sufficient blood supply, the TBSF has won the 2018 Symbol of National Quality in the Public Section, Medical Periphery category, and the 20th National Biotechnology and Medical Care Quality Silver Medal Award. For the past 40 years, the TBSF has built a solid foundation for Taiwan's blood donation movement and made Taiwan an indispensable player internationally. To access the latest information and connect with the world, the TBSF actively engages in international exchange with the American Association of Blood Banks and the International Society of Blood Transfusion. Moreover, in recent years, for the purpose of improving medical skills, the TBSF has organized training courses to strengthen international inter-industry understanding and collaboration and to promote development. The TBSF continues to steer our way through the river of life with professionalism, humanity, and technology to give back to society.